So, why do hormones decline with age? Throughout history, humans have never really lived very long. Even in the United States, the average life expectancy only exceeded 60 years since the mid 1930s. So, really, the human body doesn't have a lot of history making hormones in the optimum ranges into old age. That said, there are three additional factors to consider. First, inflammation is the number one killer of hormone production. Second, from the perspective of the body itself, optimum levels of these hormones are primarily for procreation. And that's why they're mainly secreted by the reproductive organs like the ovaries in women and the testicles in men. So if you consider that making babies isn't generally something you want to do past 50 years old, then you can see why the body wants to downregulate the production of these hormones into old age. It's a luxury that uses resources the body wants to reallocate somewhere else. And finally, consider the amount of pollutive toxins that we've been putting into our environment. In the next module, you'll learn more about these, and basically, these toxins poison our cells, and our hormone production requires good cellular function. The older you get, the more toxins you accumulate, and so your hormone production declines. Now, having said all that, does it mean that we just have to live with lower hormones? Absolutely not. This course is not just about reversing Alzheimer's, it's also about anti aging. Because reversing Alzheimer's requires you to reverse aging of the brain and other parts of your body. Can I naturally stimulate hormone production? The short answer is yes, you can. And this answer works best for testosterone because the best way to promote testosterone production naturally is to do resistance training with weights. In men, especially, heavy weights with low repetitions can help stimulate testosterone and rebuild muscle mass. Now, before you run off and start bodybuilding, make sure that you get a trainer if you've never done weights. Getting proper instruction on posture and proper weight training is quite important so you don't hurt yourself. And what about the other sex hormones? Well, the long answer is yes, you can naturally stimulate hormone production, but it's not so straightforward, and it typically doesn't work so well if you got lots of chronic infections or you're really toxic. So for sure, you have to treat the chronic infections and toxic burden if you have those. The problem is that these take a while to treat, and by a while, we could be talking months to years depending on how severe your problem is and how much you do. In the meantime, it can be really helpful to have some form of hormonal support because hormones can significantly improve your cellular function and actually upregulate your immune system to fight pathogens and support your body's detoxification systems. It's a little bit like getting a special weapon for fighting your war. For my folks who don't want to go on bioidentical hormone replacement, I usually prescribe supplement blends that include glandulars sourced from organic grass-fed animals and herbs that complement and support endocrine function. A list of these are provided for you in the Type 2 handout. These supplements can be very helpful, although they usually take time to work, unlike BHRT. My patients who go on these treatments have typically felt improved energy, mild improvements in vitality and libido, but the downside is that unlike BHRT, these are not standardized products. So we don't know how much hormone or hormone support you're actually getting with every capsule because these are natural products. So if you're on these supplements, make sure you're seeing a provider and regularly monitored. Also, know that since you're not getting a standardized product, some days may feel slightly different even though you're taking the same dose of the supplements. Now, who shouldn't be on these supplements? If you have a history of cancer, especially reproductive cancers like breast, ovarian, uterine, or testicular cancers, but really any cancer in the past, please see a well-trained gynecologist or urologist before even thinking of starting this, okay? Females with unusual uterine bleeding, even past menopause. Females who still have fibroids, uterine, or cervical polyps, and if you tested high for any of the related hormones. Also, if you have impaired liver function or liver disease, you'll have problems metabolizing the hormones in these products. So you should see a doctor to make sure that your liver is properly supported before even trying these. In any case, Do make sure that your medical provider is aware that you're taking these supplements and monitoring your hormones on a regular basis. All right, if you're interested in learning more about bioidentical hormone replacement or BHRT, join me in the next video.
This was an excerpt from our Masterclass Ending Alzheimer's with the Bredesen protocol. If you liked this video and found it helpful, you'll want to check out this masterclass at our Sophus online website. Click below to find out more.